Guys, in this video, we're going to explain the basics in innervation of abdominal viscera, the sympathetic, parasympathetic, and sensory innervation. Now, before getting into the innervation of abdominal viscera, let's get an introduction about autonomic nervous system. So you guys know that the autonomic nervous system consists of sympathetic and parasympathetic innervation. The sympathetic innervation comes from thoracolumbar segments from the T1 to L2 spinal cord segments, right? From the lateral horn of the spinal cord. So to get sympathetic innervation, if you think about your spinal cord, your spinal cord, you would expect to see paravertebral ganglia, and together these ganglia, they form what we call the sympathetic chain on both sides, all right? And these ganglia are composed of three in cervical region. We have 22 pairs, all right, 22 pairs. 3 in cervical region, 11 in thoracic, 4 lumbar, 4 sacral, and 1 coccygeal, all right? And we have the prevertebral ganglia. And the prevertebral ganglia, they basically lie in front of the vertebral column, and sometimes they call it pre-aortic. So if this is my aorta, all right, I'm expecting to see the 3 prevertebral ganglia, and that is going to be around the arteries of the abdominal wall, which is basically the celiac, the origin of the celiac artery, the superior mesenteric artery, and the inferior mesenteric artery. So these ganglia, they lie around these arteries, and they are going to take care of the sympathetic innervation of abdominal viscera. So that doesn't concern me. What concerns me is the prevertebral ganglia of the sympathetic nerves. All right. So this is what we're going to talk about now. Now, regarding the parasympathetic innervation, you guys know that the origin of the parasympathetic innervation of our bodies come from the craniosacral region. We have 4 cranial nerves that takes care of the parasympathetic innervation. Their nuclei lie in the brainstem. And for the abdomen, the only one that concerns us is the vagus nerve. However, the rest of the parasympathetic innervation of our body, which is basically down in the hindgut and in the pelvic region, comes from the pelvic splanchnic nerves. So the only part that gives parasympathetic nerves of the spinal cord is S2 to S3 to S4 spinal cord segments. So to get parasympathetic innervation from the spinal cord, that needs to be at the level of S2, S3, and S4. So 3 of them, they get us a parasympathetic innervation by something called the pelvic splanchnic nerve. All right, so in the lateral column of S2 to S4, we get the pelvic splanchnic nerves, and that is basically for the hindgut, all right, and pelvic viscera. What about the foregut and midgut? They are by the vagus nerve. This is regarding the parasympathetic innervation. What about the sympathetic? We're going to talk about that in a while, all right? So when we talk about the innervation of abdominal viscera, you guys need to remember 2 things. Whenever we talk about innervation, we're talking about motor innervation and sensory innervation, all right? So motor innervation is because I have smooth muscles, glands, anything that needs to get supplied involuntarily work, that is going to be by the autonomic innervation, and that would be by the sympathetic and parasympathetic nervous system, all right? Now, to talk about the motor innervation, we have, remember, the 3 ganglia, the celiac, the superior mesenteric, and inferior mesenteric, all right? So we have spinal cord levels that gives nerves, and these nerves go all the way and relay in that ganglia, and then these ganglia are near to the organs that need to supply, and then they give the postsynaptic nerves that goes all the way and supply the viscera. Now, when we talk about the celiac ganglion, the celiac ganglion receives innervation from the greater splanchnic nerve. All right, we have the greater, we have lesser, we have least, and we have lumbar. I'm not talking about the least, because the least goes to the aortic-renal ganglia, and that is out of the scope of my abdominal viscera for now. So I'm not going to talk about this. I want you to understand the abdominal, the organs of digestion. All right. So that's why I'm going to talk about the celiac, superior mesenteric, and inferior and mesenteric ganglia. For the celiac ganglia, it receives innervation from the greater splanchnic nerve. All right, the greater splanchnic nerve comes out from T5 all the way to T9 segment. So greater splanchnic nerve, it comes out from the spinal cord segments T5 to T9 without relay. It goes all the way to the pre-aortic ganglia that lies in front of the aorta around the celiac artery, which is the celiac ganglia. It relays there, and it sends innervation to the foregut organs. You guys, please make sure you know the foregut organs, all right? Because this is important in the clinical differentiation of a pain of abdominal viscera, all right? And then I have the superior mesenteric. It receives from the lesser splanchnic nerve. That nerve, it comes out from T10 to T11. It goes all the way to the superior mesenteric ganglia, and that ganglia lies around the superior mesenteric artery, and it relays there, and then it gives supply to the midgut, and that midgut finishes at the junction of the right 2/3 of transverse colon to the left 1/3 of transverse colon. So all the way up until this, the sympathetic innervation comes from the superior mesenteric ganglia. Even the arterial supply comes from the superior mesenteric artery. And it's important because, again, the differential diagnosis of the pain. And for the inferior mesenteric ganglion, it comes from the lumbar splanchnic nerves, L1 to L3. It goes all the way to the inferior mesenteric, and that takes care of the hindgut. Here we're talking about the sympathetic innervation of abdominal viscera. We are specifically talking about the organs of digestion. And what about the parasympathetic? It's very easy. The vagus takes care of everything up until the junction of the right 2/3 with the 1/3 on the left, which is the foregut and midgut. So foregut and midgut receives parasympathetic innervation from the vagus nerve, all right? However, the hindgut and the pelvic organs receive from the pelvic splanchnic nerves, S2 to S4. All right. So this is the sympathetic innervation, motor and parasympathetic. This is general idea, and the most important thing is the sensory, because we need to understand what happens in the pain and how do we feel pain. So for the motor, okay, everyone knows the sympathetic and parasympathetic. Sympathetic by the pre-aortic ganglia, the celiac, superior mesenteric, inferior mesenteric, celiac, superior mesenteric and inferior mesenteric, and the parasympathetic by vagus, foregut and midgut, and for the hindgut by the pelvic splanchnic nerve. Now, what happens in the sensory innervation? Now, I'm giving sympathetic and parasympathetic to take care of the glands, the peristaltic movement, when to open the sphincters, and everything is fine. And now we know the innervation. What about the sensation? I want you guys to know one important thing. Yes, we have innervation from sympathetic and parasympathetic everywhere in our bodies, but you need to know that for the sensory innervation, for carrying pain sensation, this is following a specific rule. There is something called pelvic pain line. Pelvic pain line, it's at the mid-sigmoid point. If I have pain coming from above the pelvic pain line, the sensory, the sensation of pain follows the sympathetic innervation. If I have pain that comes after the mid-sigmoid point, it's going to follow the parasympathetic innervation. All right. So up until the mid-sigmoid point, the pain, the visceral pain sensation follows the sympathetic route. And after the mid-sigmoid point, the pain is following parasympathetic route. This is why it's important, because visceral pain is felt by following this rule. Now, what kind of pain do we feel? It's dull, vague, discomfort, everything that's not sharp and it's not localized. Why is that important? Because if you guys have a patient in the clinic and that patient comes to the clinic with a pain around these areas, which is following the sympathetic innervation, you have to think about a problem with the foregut if it's at the epigastric region. If it's around the umbilicus, you have to think a problem in the midgut. And if it's in the hypogastric region, you need to think about a problem with the hindgut. We're gonna see that into more details. So if I have a patient comes to the clinic with dull pain, discomfort, not localized, and he's showing me a pain in the foregut, it means a problem in the epigastric region. He's pointing at that area. I need to think about any of the organs that are derivatives of the foregut, which is maybe the liver, the gallbladder, the stomach, pancreas. So remember when I talked about the cholecystitis, and I told you guys the epigastric region, because this is why the sympathetic innervation is carrying the pain. All right, so everything here, we're following the sympathetic innervation. We are following the sympathetic nerves because the pain is carried by sympathetic nerves in the digestive organs. All right, all the way up until the mid-sigmoid point, we're talking about sympathetic. All right, so if I have a patient with a dull discomfort, not localized pain here, I have to think about problem with the foregut. If he's pointing at the mid abdomen or periumbilical region, I have to think about a problem with the midgut, which is from the second part of the duodenum all the way to the junction between right 2/3 of transverse colon and left 1/3 of transverse colon. It means this is a problem with a midgut structure. If he's pointing at a hypogastric region, I have to think about the hindgut, which is the 1/3, the last 1/3 of transverse colon and down. Why is that important for the midgut? Let's say if I have a patient complains from a problem here, all right, and that could be appendicitis. That patient could have a problem with his appendix, and because appendix is part of the midgut, so at the beginning, what's going to be giving me the pain is the viscera, and the visceral peritoneum, when it gets irritated, that again follows the sympathetic innervation. And I said that the sympathetic innervation gives me pain up around the midgut region, which is the periumbilical region. So in the initial stages of appendicitis, I would expect to see a patient with a problem here. However, if the inflammation gets more and more and more, and that organ touches the parietal peritoneum, all right, it means it's going into somatic innervation. And if that goes to the somatic innervation, it's going to give me a localized pain, because somatic nerves are localized sharp pain. And that area is going to be called the McBurney's point, which is basically a point from this 2/3 line from the umbilicus to 1/3 to the ASIS. The McBurney's is the area where I have the appendix. And in this case, I'm irritating the somatic nerves. And here it is localized pain. All right, but however, if I have a problem in the initial stages, it's going to follow the sympathetic innervation, and this is where I would expect to see pain if there is a visceral pain which is not localized, dull pain. Okay. So here again, this is the same point, because when I talked about the appendix, it was supplied by T10. All right, so if I have a T10 problem, appendix, let's say, that's gonna be here. If I have cholecystitis or problem with the gallbladder, it's gonna be in the gallbladder, the epigastric region. That's all when the problem is at the beginning and it's visceral pain, dull, not localized. However, when it becomes more and more and more, it irritates the parietal peritoneum, and then in that case, it becomes localized. And then I can come to know that the problem is where exactly, because it irritates the somatic nerves. All right. So this is the idea of the innervation of abdominal viscera, and this is why it's important, because of the pain. I hope you guys grasp the whole concept. I hope you understand how to differentiate a problem arising from any of the digestive organs, and you know the place of the pain and why, and which route do they follow. when the pain is referred. Don't forget to like and subscribe, and thanks for watching.